For Poland Daily News, I'm Phil Goss. Poland's health ministry announced 9,505 new and confirmed COVID-19 infections in Poland today, increasing the total to more than 2,750,000, of which more than 260,000 are still active cases. The 9,505 new cases confirm the downward trend of the pandemic in Poland, as more than 15,000 new cases were reported last Saturday. The ministry announced 513 new fatalities, of which 136 were due to COVID-19 alone and 377 from COVID-19 and concurrent diseases. The COVID death toll in Poland is now over 65,000. Almost 250,000 people are currently under quarantine, while nearly 2.5 million others have recovered from the disease. Another important milestone has been reached in the national vaccination program, as more than 10 million people have received at least one dose of the vaccine. As of Saturday morning, more than 146 million cases and 3 million deaths had been recorded worldwide. The U.S. remains the country with the largest number of confirmed coronavirus cases, accounting for more than 32 million cases, while India and Brazil are second and third, with 16 and 14 million cases respectively. While COVID-19 cases are dropping in Poland, the situation in India has taken a turn for the worse, with nearly 350,000 new infections recorded today, the highest daily figure reported by any country since the outbreak of the pandemic more than a year ago. Indian hospitals are buckling under the pressure, and there is a critical shortage of oxygen. COVID-19 patients and their families waited outside overwhelmed New Delhi hospitals on Saturday morning, waiting to be admitted as the country's coronavirus infections rose by 346,786 overnight. Saturday's surge in coronavirus cases set a new world record for the third consecutive day, as overwhelmed hospitals in the densely populated country begged for oxygen supplies. I came here to get my grandfather treated. He is suffering from COVID-19. They are not letting us in. We don't understand anything. The guard is saying there are no doctors available. If there's no doctor near the emergency ward, then where will we go? His oxygen level is dropping at an alarming rate. The managing director of Batra Hospital, a Dr. Gupta, said that after pleading for 12 hours, they finally received 500 liters, far short of the 8,000 liters they need every day. We have just received 500 liters of oxygen. This will last for maybe 30 to 45 minutes. The requirement for a day is 8,000 liters. We don't understand what to do with this 500 liters when we require up to 8,000 liters. We don't even know what we will get or what we will do after the half hour is over. We only got this 500 liters of oxygen after pleading for 12 hours. Stricken patients and their helpless relatives say they've been going around hospitals in the capital hoping to be admitted, but have repeatedly been turned away due to a shortage of both beds and oxygen, with the added complication of overburdened health workers. If the government wants, they can do anything. They have the power and they are using it also. The problem is that they are not doing it properly, in the right direction. It looks like we are wandering aimlessly. I go from hospital to hospital. I've been pleading with everyone, every person I meet, and I'm also paying, but to no avail. India is in the grip of a rampaging second wave of the pandemic, hitting a rate of one COVID-19 death in just under every 4 minutes in Delhi, as the capital's underfunded health system buckles. Indonesian search and rescue teams have located the missing submarine lost in the Bali Sea, officials said on Saturday morning. Having been found at a depth of 850 meters means that the chances of any of the 53 crew members having survived are very slim, as the submarine had only been built to withstand water pressure to depths of 500 meters. Indonesian Navy Chief of Staff Yudo Margono said a scan had detected the 44-year-old KRI Nanggala 402 submarine at a depth of 850 meters. It had lost contact on Wednesday during preparations for a torpedo drill. Apart from the depth at which it was found, hopes for rescuing survivors also dwindled, as the crew was expected to have run out of oxygen by Saturday morning. Over the past few days, we have found several pieces of debris at the location where the submarine was last seen while submerging. These are believed to be parts or components that were attached to the submarine. These would not have come off the ship without external pressure, or there were not a crack in the torpedo launcher. Researchers have sent over a dozen search helicopters and ships to the submarine's last known location. Japan, the United States, Australia, Singapore, Malaysia, and India providing assistance. According to Yudho, if it lost power, the submarine would only have had enough air to last until around dawn on Saturday, but that it could last as long as 5 days if the vessel were to have maintained electrical power. Experts say this assessment is optimistic and express concerns that the submarine may have been crushed by water pressure. There is a crack because of the pressure at the 800-meter depth. This will cause cracks to occur in the submarine and can bring things that are inside to the surface. Indonesia operates 5 submarines, 2 German-built Type 209s, including the Nanggala, and 3 newer South Korean-made vessels. It has been seeking to modernize its defense capabilities, but some of its equipment is old, and there have been fatal accidents in recent years. A 4-astronaut team launched by NASA and Elon Musk's commercial rocket company SpaceX has become the first crew ever to reach the International Space Station with the help of a rocket booster recycled from a previous spaceflight. The new technology, developed by SpaceX, will drastically reduce costs for manned spaceflight. The company's Dragon crew capsule, Endeavour, was launched into orbit atop a SpaceX Falcon 9 rocket on Friday before arriving almost a day later to the space station, orbiting some 400 kilometers above Earth. Within 10 minutes of launch, the rocket's second stage had delivered the crew capsule to Earth orbit, traveling at nearly 27,000 kilometers per hour. The rocket's first stage, meanwhile, descended back to Earth and touched down safely on a drone ship landing platform floating in the Atlantic. The new crew members to reach the ISS include 2 NASA astronauts, Shane Kimbrough and Megan MacArthur, along with Japanese astronaut Akihiko Hoshide and French engineer Thomas Pesquet of the European Space Agency. Interviewed ahead of the launch, the French astronaut stated that a new golden age of spaceflight has started thanks to technological advances. I think we're living in the golden age of manned flights right now. I think people don't realize it. We often look back to the 1960s and the moon missions, but in just a few years we will have done something even more ambitious. We're not trying to live this adventure selfishly, we're really trying to share it. And in particular, because what we do in space, we think that it will be useful to everyone. The mission to the ISS was the 3rd crewed flight launched into orbit under NASA's fledgling public-private partnership with SpaceX, the rocket company founded and owned by Musk, a billionaire entrepreneur who is also CEO of electric car maker Tesla.
For Poland Daily News, I'm Phil Goss. Good night.